Good afternoon, everyone. Thank you so much for joining JET Foundation's virtual family workshop series. For those of you who may not know me, my name is Nick Jacobs, and I am JET Foundation's program associate, and I've been a part of the organization for 2 years now. We're so excited to have an informational session today with Sarah Clark-Stoney, outpatient neurology social worker from Children's Hospital of Philadelphia. Sarah will give a presentation about advocating for yourself, sex, relationships, friendships, and much more. She will be available for live questions and answers immediately following her presentation. We're just going to wait a few more minutes and allow other attendees to join before we begin, so please wait shortly for the presentation. All right, for those of you who are just getting on, thank you so much for joining JET Foundation's virtual family workshop series. My name is Nick Jacobs, and I'm JET Foundation's program associate, and I've been a part of the organization for 2 years now. Today, we are excited to have Sarah Clark-Stoney, outpatient neurology social worker from Children's Hospital Philadelphia. Sarah will give a presentation about advocating for yourself, sex, relationships, friendships, and much more. She will be available for live questions and answers immediately following her presentation. Thank you all again for joining us today. And with that being said, we're going to start the presentation. I'll pass it over to you, Sarah.
Thank you so much, Nick, and thank you to Nick and Danielle and everyone else at the Jet Foundation for having me. I am always super excited to be able to talk to our awesome patients in the neuromuscular community, so thank you so much to all of you joining today. I understand that we may have a wide variety of audience today, perhaps healthcare providers, perhaps parents, perhaps individuals living with DMD or other neuromuscular disorders. I hope that the information I present to you is kind of all encompassing and you're still able to get something out of it. So as Nick mentioned, I am an outpatient subspecialty social worker at Children's Hospital of Philadelphia. I work in neurology and I've been there for about 6 years, working in the neuromuscular population as well as a few other subspecialty clinics in neurology. My first disclaimer is that I am in no way, shape, or form an expert in what we're going to talk about today. That I really gain all of my knowledge and experience from working with our really awesome patient population. So we do see patients into young adulthood. I learn so much from them, and I've also been collaborating with colleagues around other neurology specialties as well. So as Nick mentioned, we're going to talk about today relationships, sex, adolescence, all within the context of the DMD community. Okay. All right, so a quick breakdown of what we're going to talk about today. We're just going to go right in there and talk about that elephant in the room. We're going to talk about relationships, dating, and sexual health, a topic that I feel like is really underserved in the neuromuscular community. We're going to talk about defining sexuality, really understanding that sexuality is so much more than just basic gender or basic sexual preference, that really it embodies many things that contribute to body image and self-esteem. We're going to understand that impact of body image and sexual health on your self-esteem. We're going to understand the barriers to advocating for sexual education in the DMD community and how we all as individuals can help regardless of our role. And we're going to discuss ways to normalize this conversation about sexual health and preference. We're going to talk about how to advocate and how that independence and advocacy translates from childhood to adolescence and then into adulthood. So first, when we talk about sexuality, sexuality really is about who we are and how we express ourselves. There is a wide range of how people experience their sexuality. Your sexuality may be influenced by family, culture, religion, media, friends, or other experiences. And no matter how important sexuality is to you, we all have thoughts, desires, attractions, and values that are very unique. So what is this built upon? So we talk about body image, certainly as being a contributing factor to how we experience our sexuality. Our biological sex, the sex we're assigned at birth, whether that's male, female, or intersex gender being a boy, girl, woman, man, or transgender or genderqueer. Our identity around gender, feelings about and how we express our gender. Our sexual orientation, values, attitudes, and ideals about life, love, and sexual relationships, our feelings towards family planning and our goals surrounding family planning, and also our sexual preferences and behaviors. So when we talk about body image, I think it's a really underserved topic, particularly in the neuromuscular community, because as we know, a body image is something that starts our view of our body and our relationship with our body really starts in childhood. And people with neuromuscular disorders, particularly those that are progressive, have a confusing relationship often when they're learning from their bodies, their self-image and their self-portrayal, because the messages from media and society are that individuals with physical disabilities are grossly underrepresented. So we don't see people with physical disabilities as much as we should in ad campaigns or in mainstream television. So the messages that we receive are very conflicting versus people with physical disabilities and those that are able-bodied. A recent study investigated that association between sexual and psychological well-being in people with physical disabilities. Out of approximately 1,200 participants, half about had physical disabilities and half were able-bodied, and the results clearly demonstrated that sexual esteem, body esteem, and sexual satisfactions were strong predictors of self-esteem and depression amongst people with physical disabilities, and that this relationship was stronger among people with physical disabilities than able-bodied participants. The results of the study suggest that researchers and clinicians who are concerned with the psychological health of people with physical disabilities should really consider strategies to improve body esteem and the sexual well-being of people with physical disabilities. It really kind of reinforces that these are conversations that really should be happening. So how do we promote self-love? How do we promote acceptance and individuality? And how do we maintain the growth and health of a healthy sexual relationship? So some questions to consider when thinking about your own healthcare. Does your clinic discuss sexual health with you? Do you have an opportunity to speak with your doctor in private without a parent, a partner, or a caregiver? Or would you feel comfortable raising questions regarding sexual health to your doctor? My hope is that most of you answered yes to that question, to those questions. And if you answered no, hopefully we can help address some of that today and help give you tips and tricks on tools on how to have those conversations more with more ease. Okay, so going back to this elephant in the room, Dr. Beers is quoted saying that many disabled individuals avoid intimacy because they lack the knowledge about sexual health that is routinely provided to individuals without physical disabilities. And I think that that's really important to say because I think that it also highlights the fact that when we don't talk about something and we don't provide it the presence that it needs or the audience that it needs, then we're not really giving it due justice. And we're also telling our young adults and telling our individuals with neuromuscular diseases that these are topics that are not worthy of a conversation, and that these are topics that come second to physical health and maybe and also jointly your emotional and mental health. Dr. Shapuk, who's a psychologist in New York, talks a lot about the power of projections. She works specifically with individuals that have neuromuscular diseases and has said that these are all projections that her clients have shared with her, that there's an assumption that they're not able to have sex, that they can't be a husband or a wife, that they're weak or asexual or infertile, or they can't be a father, or that sex isn't important. And the theme of projections is going to come up a couple times today throughout the talk. And what I really want to note is that when we project and when we make these assumptions, we are not allowing our individuals to grow. This is why it's so important for us to have these discussions and to make sure that we are acknowledging to our individuals living with DMD or other neuromuscular disorders that talking about a healthy sex life is really important. Okay. Because most importantly, intimacy is absolutely a human right. Back in 1986, the American Occupational Therapy Association categorized sexual expression, defined as engaging in desired sexual and intimate activities, as an activity of daily living. Yes, an ADL. This places it in the same realm as dressing, eating, toileting in terms of activities to focus on during rehabilitation. So who can we turn to help? So going back to those questions I asked you to consider, in terms of talking with your physician about questions regarding sexual health, these are all the different types of providers that can provide assistance. This is outlined in a document called Pleasure Abled. It's by an occupational therapist at the University of British Columbia, Ms. Naftali, and she has written a manual for people with disabilities surrounding intimacy. She outlines that urologists, gynecologists, and neurologists are all valuable experts in this area. Physicians can then refer to other healthcare professionals as needed, and they can also talk about fertility difficulties and family planning. Occupational therapists can also address these issues around sexuality by teaching skills such as how to organize a daily routine to allow time for intimacy, managing personal hygiene before and during intimacy, and compensate for the reduction or loss of typical body function. They can also alter or eliminate environmental barriers for intimacy. They may even be able to suggest adaptive devices or objects that can assist in your sexual health. Physical therapists can educate and assist clients with skills such as transferring from wheelchair to bed, repositioning in bed, maintaining balance, and maximizing comfort in intimate positions. Social workers play a large role in the education around sexual and fertility issues. They can also assist with ongoing support and connection with other resources. Therapists or psychotherapists explore in depth with patients the very many different emotional components of sexuality, such as self-esteem, assertiveness, and positive self-talk, as well as collaborate with partners and family around sexual and fertility issues in family planning. Then there are recreational therapists. They work with clients to explore meaningful recreation and leisure choices. Using clients' interests, recreational therapists can connect people with the community-based resources that help build confidence and increase opportunities for social interaction. Friendship development through involvement in recreation activities is usually key to finding people and potential partners by having common interests and common activities. Peer counselors are absolutely positively one of the best untapped resources. Other individuals with physical disabilities themselves are critical sources of information and expertise. They are the experts on what their bodies needs. They also have experience across accessing different resources in the community and can share suggestions about what has or hasn't worked for themselves and other individuals. There are even sexual medicine physicians and physiatrists that can assist with maximizing intimacy physiology, as well as reducing the medical issues that interfere with sexual interests and activities. And lastly, there are certified sex therapists that are also known as sexual health psychotherapists. And they also are psychotherapists that engage in didactic talk therapy that can help with assistance around emotional and physical goals of sexual health and well-being. If you look at the blue circle on the screen, the American Association of Sexuality Educators, Counselors, and Therapists is a phenomenal website and resource. On that site, you can actually go on there and look for a certified sex therapist in your area. Many of whom have virtual options if you are interested, but is an absolute great place to start if you would like to engage in this conversation from an emotional standpoint first. Okay, so what do we do now to help engage in this conversation? What can we do to advocate for better access to sexual information for our neuromuscular community? So as medical providers, my first recommendation is to not assume or project, and this includes not assuming a person's gender, identity, or sexual preference, and also not assuming societal expectations on gender norms. For example, assuming that someone may or may not have a partner at a specific age or have specific goals surrounding family planning. Always ask open-ended questions to engage in a conversation. When possible, and when the patient is agreeable, offer them a private space in order to ask questions around sexual health. Be able and ready to provide resources when needed, even if you don't know the answer. Make sure that you acknowledge to the patient that even though you may not know the answer, you may have the right resource for them, and be sure to follow up. And acknowledge and validate the importance of a healthy sex life and the patient's right to have sexual relationships. So as social workers and mental health professionals, this is a lot more common in our work than I feel for some of our medical providers. So we want to ensure that patients and parents are comfortable asking questions as early as puberty. We want to make sure we are building that ongoing trusting relationship with patients, increasing a level of comfortability when discussing sexuality. We want to normalize this conversation. We want to make sure that our patients and clients feel comfortable coming to us and asking us these questions. We also are going to avoid making projections and assumptions, asking open-ended questions, increasing the dialogue. We want to validate you and empower our patients, and we want to get you talking specifically to one another if possible. So as parents, if you're joining us, communicate. I can't say it enough. Keep those floodgates of communication open. The more comfortable that your youth or teen or young adult feels coming to you, discussing a challenge or a barrier or a goal that they have related to intimacy, the more resources they're going to have access to. And you're also responsible for playing the really tough balancing game, showing interest and asking questions about relationships and friendships, while also allowing for privacy and individuality to grow. Ask questions about future goals related to family, relationships, and love, and teaching them to advocate for themselves. We're going to talk about advocacy a little bit more towards the end of the presentation, but it's a huge piece that really kind of coincides with how we build the skills to be able to better advocate for ourselves. And then as individuals living with DMD or other neuromuscular disorders, my first advice to you is to do not project assumptions on others. Yes, it was that important to me that I put it twice. I run, which we're going to talk about in a minute, I co-facilitate a young adult support group for individuals with neuromuscular disease. And a few years ago, we did a relationship series, and we had author Shane Burkall come, who lives with SMA type 2, and he's an author and comedian. He has a blog and a few books. And he came with his partner at the time, and he was giving a discussion about how he and his partner had met and their relationship. And one of the things that he said that has always stuck with me is that in every relationship that he has been in, he has tried his hardest not to project his assumptions on his future partner. He tried his hardest not to allow himself to think, oh, my partner's not going to want to be involved in my personal hygiene care, or my partner isn't going to be happy with the fact that I may not be able to do everything that he or she may be able to do. And by doing that, it really opened the doors for allowing the possibility for so many more relationships, friendships, and romantic interests. So not to make those assumptions for other individuals is so important on building those connections. We want you, of course, to surround yourself with friends and loved ones that promote self-love and self-admiration, and finding your own balance between transparency and privacy. Okay, so relationships and dating. I love the word cloud that we have on the side, because I think that particularly in times of COVID, but even prior to COVID, I feel like I talk to so many teens and young adults in the neuromuscular community that really rely on technology a lot to communicate and to form friendships and relationships with people. So technology is certainly, I think, changing the game of dating for everyone, but particularly for people with physical disabilities. And so when we talk about those connections, that same foundation that builds your friendships is likely going to be a similar foundation for future relationships. Those common connections that you make with individuals that have similar interests, or have similar interests, but then also too, for people that have the same values and same belief systems, all those same common connections is going to be a lot of that foundation. Those qualities that you find in friends are likely going to translate to what you're looking for in a partner. Remember your goals and remember your expectations. And remember, do not project assumptions on others. Okay, family planning, something that is not talked about, I'm sure, enough in our medical appointments, but something that needs a lot more attention. And it really does start with having conversations about sex and puberty, because those limited discussions about sex usually leads to a lack of preparation for family planning. And conversations don't have to wait for adult providers. Many men with DMD and other neuromuscular disorders are followed by pediatric providers well into young adulthood. So these are all conversations that should be taking place as early as puberty, and then conversations that go on through adolescence into young adulthood. There are many definitions of family. So knowing what your personal goals are will help you determine what your family planning will look like. Okay, I'm going to talk just for a few minutes about our MDA Young Support Group. I co-facilitate this with a member from the Muscular Dystrophy Association. Prior even to COVID, we're all adjusting to our online lives now in the light of COVID-19. But even prior to COVID, we did a lot of this support group online, which was great. And we specifically did a relationship series that I'd like to talk about. So our young adult support group really targets individuals registered with the Muscular Dystrophy Association living with any neuromuscular disorder from 18 to 30. We combine psychoeducational sessions also with supportive sessions, the difference being that the psychoeducational, we try to provide information and resources and often have guest speakers, and then supportive sessions where we leave the group more open and have time to just communicate and converse with others and kind of be able to learn from one another. So we've had both online and in-person sessions. It creates an amazing format for people to be able to connect with one another without any regard for physical distance, particularly for our patients with neuromuscular disorders. Getting to and from a support group oftentimes presents challenges, so the virtual option is certainly much more ideal. So we have done our relationship series a few times. As you can imagine, it's super popular, which I love because we love talking about these things with our young adults. And every time we do our relationship series, which we haven't done one in a while, we kind of split it up into three parts. The first one being creating connections, the second one establishing relationships, and then the third one on sexual health. So when we talk about creating connections, we're literally talking about those connections that we are making just with other individuals in the community. So they're not necessarily romantic in nature, they're not even necessarily long-term in nature. It's really more or less of how are we connecting with one another and what are those common interests looking like. Gaming and social media are always huge topics on those in that discussion. Gaming, particularly in the last 5 to 10 years, has really become a completely different platform for how people communicate and really interact with one another over the internet. So there's a huge avenue there for an ability to connect with others. Social media, even online friend apps on your phone, all are different ways and tips to and tricks on how to connect with other people in the community without even leaving your home. We talk about challenges, even in maintaining friendships, whether that is physical distance or common interests, and really navigating social environments, particularly as someone with a neuromuscular disorder. When we talk about establishing relationships, there it is again, we talk about avoiding projections. We talk about dating and what dating looks like. And even though of course, we have a wide range of participants in our support group, people with all different types of neuromuscular diseases, we talk about like how to assess what dating will look like for you as an individual. How does that work with healthcare providers or home care providers, or accessing a non-accessible, building for a date? All those different types of topics we try to go over and talk about how we advocate in those situations. We talk about a variety of different dating apps and what people are doing to connect with people romantically. And we often have guest speakers. We have had a few, two of which, one being Shane Burkall, who I already mentioned, and then we've also had Bill Crossland, who's another individual living with neuromuscular disease. He made a short film that went to Sundance about falling in love with an able-bodied person, which is phenomenal. And he came to talk about his basis for making the movie. And then we have sessions on sexual health, which, as you can imagine, are super popular also. We talk about, encourage people and their partners to participate in the sessions. We want to make sure that we give full transparency and that people's questions and are being answered. We discuss body image and its impact on sexual health. And again, we've had amazing guest speakers. As I've mentioned, I am not an expert in this area, so I certainly try to bring in experts to be able to answer all your questions. One is a woman by the name of Catherine Starantino. She is a licensed clinical social worker as well as a certified sex therapist that is based out of Pennsylvania. She does work with patients with all different types of disabilities, including muscular dystrophy and spinal cord injury, and sees patients virtually and in person. And then we also have Dr. Danielle Shapok. She has a pretty large presence on YouTube and other platforms. She is an individual that lives with SMA type 2. She works with patients, I think, both virtually and in person out of the New York area, but does a lot of advocacy for people in the neuromuscular community in regards to sexual health and dating. And we talk about how to advocate for a healthy sexual relationship with your healthcare providers, how to have these conversations with your partners, and really how to even have these conversations with yourself, even though I know that that sounds strange. I think that a lot of times in the neuromuscular community that a lot of medical goals and medical care can so often get prioritized, and that's absolutely, of course, important. We just want to make sure that we're giving due to the other areas of people's psychosocial lives that also deserve attention. And how we do a lot of this is through advocacy. In my 6 years of working at CHOP and working with the neuromuscular community and other subspecialties, I am always amazed and blown away at the superhero patients and parents that I have the opportunity to work with. There is not a day that goes by where I am not blown away just by what strong advocates and how incredible so many of these patients are. I see so many great examples every day of how patients are advocating for themselves and how parents are showing kids how to advocate, because it is so, so, so important. Self-advocacy specifically is really important for children to learn young. Individuals learn this by creating solutions for challenges, and even though us as parents can always advocate for our kids, children who self-advocate have so many extra benefits. Children who exercise self-advocacy find solutions to challenges that parents may not even be aware of. They build self-confidence in their ability to learn and to address problems. They create a sense of ownership over their learning and develop independence and self-empowerment skills. So why self-advocacy? So self-advocacy provides individuals with a skill set that they need to achieve independence. And this skill set can be applied to all different areas of a person's life, whether it's personal, medical, or professional. The graphic on the right, which you may recognize, is the famous Capitol Crawl, as it's known. It's from March 12th of 1990, back when ADA was getting signed into law. It's such a famous photo that over 400 people with physical disabilities took to the Capitol steps, many, as you see, climbing out of their wheelchairs and physically climbing up the steps. Over 2,000 people with physical disabilities were present during the signing of ADA when it was signed into law. And it's such an important part of history in learning about where our rights came from when it comes to people living with disabilities. I say this because when I have patients that are asking me questions about advocacy and how to advocate for themselves, I fully acknowledge and empathize with you that we do not live in a perfect world or a perfect system, and that oftentimes the world that surrounds us is set up to present a lot of challenges and barriers. It is not fair by any means that people in the neuromuscular community have to advocate so much harder than people that are able-bodied. With that being said, we do have laws in place, such as the ADA, IEP laws for people that are school age, that help protect our individuals with physical disabilities in order to help get them the supports that they need. So that is why we try to do education like this. We try to connect you with social services or social workers or child life specialists in the community or in your hospital to make sure that we're giving you access to all of the information and resources that you need. So in terms of talking about self-advocacy, I want to just go over, there's so many different ways that you can incorporate self-advocacy into a variety of different topics. I'm going to talk just briefly about 3 topics that I've picked, one being school, and then we're going to talk about healthcare, and then, of course, self-advocacy for yourself and peers. So I've split these up into 3 different age ranges, with just some suggestions on ways that you can promote advocacy. And this is hopefully applicable to parents that may be listening as well as individuals. So in childhood, allow your children to attend their IEP meetings and their 504 planning meetings. Allow them to be a part of that conversation. Allow children to verbalize what their barriers are at school and possible solutions. And you can even allow them to try to address issues at school without intervening to see if they're able to do things like that on their own yet. In adolescence, not only allow those teens to attend, but also allow them to be an active participant in IEP meetings and 504 planning meetings, having them prepare statements or issues that have come up in school that they want to see addressed. You can also allow teens to tour future schools and campuses to identify specific barriers or challenges. And in adulthood, young adults actually are typically encouraged by colleges to independently register with their Office of Disabilities without the assistance of parents or other loved ones, to be able to really outline what it is that they will need, not just in college, but in terms of living on campus and other supports. They can also navigate programs like OVR. It's OVR in Pennsylvania, but I think in every state it's called something different. But that's the Office of Vocational Rehabilitation for ongoing long-term job support. You're assigned a caseworker, and you can stay in constant communication with them to make sure that they're providing the support that they're required to in order to ensure that you have full access to school and to work. So switching gears to healthcare, for childhood, I'm really encouraging using hospital resources such as social workers or child life specialists to ensure that children have an understanding of their diagnosis and their medical needs. The more information that they have, the more they'll be able to ask the appropriate questions. And even instruct children to develop questions for their doctor's appointments. Allow them to think, before they go to the neurologist or cardiologist or orthopedic doctor, if they have any questions, even if it's something about, what color brace they can get or why they have to have a certain test done. Any questions that kind of come from them will also be a good gauge for you as a parent to understand their level of understanding. As adolescents, allow teens time to talk with physicians privately to ask personal questions. We typically try to start this practice, try to start this practice at CHOP around 14 years old. Of course, if everyone is agreeable to it and there's a level of comfort there, and allow teens to be part of the medical planning. And this is, we also do a talk on transition of care. In transition, oftentimes there's a need to really do a lot of teaching and educating to our teens and young adults about what they have to do to manage their health care. We have some great resources at CHOP that we've developed in our neuromuscular program that really help provide information on topics like insurance, mental health, equipment, how to follow up with specialists that I'm happy to share with the Jet Foundation for them to distribute. But really, how a lot of this independence gets done, particularly around healthcare, is by spoon feeding, small expectations and tasks to our teens. So even things like calling and making a doctor's appointment or getting a medication refill is providing them with tools that they can build on in the future. And as adults, having discussions regarding future planning, advanced directives, goals of care, what those look like, power of attorney, or living wills if necessary, and aim for independence in hiring support staff. And this can actually even happen sooner on in adolescence or teens, really allowing them to direct the interview process for any home healthcare workers can be a very great task that builds independence. And when we're talking about our relationships with peers and selves, we want to promote advocacy in those areas as well. So in childhood, we want to, keep open lines of communication. Allow your kids to ask questions, to bring up concerns, and just so that they know that they have a place that they can go to if they don't understand something or they have a question. Having conversations about learning and accepting differences in others. That's going to help with how they formulate friendships with others and allow them to have those expectations in others that they choose to engage in friendships with. In adolescence, we want to teach self-care early and stress the importance of taking care of body and mind. Thankfully now in 2020, back when I went to college a very long time ago, mindfulness and different self-care was kind of on the cusp of becoming popular. I'm so happy now that I feel like in 2020, mental health has taken a little bit more of a center stage. So even tasks like asking our teens if they want to talk to a counselor or being engaged in therapy or having some sort of practice that promotes their physical and emotional well-being is so important. Learning about the laws that protect individuals with disabilities, including things like the American Disabilities Act. And then in adulthood, connecting with organizations that can help provide assistance and support for individuals living with disabilities, whether that's a diagnosis support or diagnosis-specific support organization, or a state or government agency that's going to provide you with your medically necessary supports. Those types of connections are super important to help assist you in the advocating process. And then also educating others, which this goes back to the burden itself of self-advocating. You're probably thinking to yourself, oh, now I have to talk and teach others about what's going on with me. That's putting more on my plate, but it's so important because the more conversations that we have about each other's differences and about how we learn and accept those differences in others, is the more that we're going to promote a more loving and accepting space just in our general community. And just to wrap up our conversation on advocacy, of course, when we teach others to advocate for themselves, we all win. So whether advocating for school accommodations, proper health care, or achieving goals, or learning how to advocate for yourself, this is key for achieving long-term goals. Learning young to speak up and ask for help, accepting assistance will only benefit those in the long term. And having discussions around personal goals such as sexual health or family planning, it really takes practice and self-advocacy skills, which is why we want to talk about these things super young. So we talked about so much stuff today. I want to make sure that we leave time for questions and answers. So you may be thinking to yourself, regardless of what your role may be, where on earth do I begin with this? So we're just going to have a quick review. So healthcare providers that may be joining us, remember to normalize conversations around sex and intimacy, give patients privacy when they ask for it, ask questions about their relationships, and show an investment in their emotional health as well as their physical health, and provide resources when asked. For parents, again, normalize that conversation, keep the doors of communication wide open, even around sex and intimacy. Have conversations with your teens or your young adults about their personal goals. Empower your child to become more responsible for managing their own health care, and most importantly, listen. And as individuals living with neuromuscular disease, probably the number one thing that I hope that you take away from today is really the need for self-reflection and goal setting. And though this may sound easy, it's not always the case. So there's definitely a level of knowing yourself, accepting yourself, appreciating yourself that takes place in understanding what your future goals are. So that's absolutely incredibly important. Picking your team, knowing that the people around you promote your self-love and your acceptance, having that team with you for life's challenges is absolutely important. Communicating with others your questions, wishes, and goals for the future. And I'll say it one last time, not projecting those assumptions on others. So that's everything that I have for today. I want to thank everybody for joining us, and I think we have a few minutes for questions and answers.
Yeah, thank you so much for that presentation, Sarah. We'll now take a moment and begin our live question and answers session. So for all
Sure.
questions and comments, please drop them in the chat section below.
Oh, I see a question. Can anyone join the support group? Please share more information. Yes, the only thing that we need is that you are registered with the Muscular Dystrophy Association in some capacity. If you aren't already, it's really a matter of completing a quick form. I can share can I type my email in the chat for others to take down? Is that okay? That's my email. If you are interested in joining our support group, please feel free to reach out to me. We have been on a minor hiatus because my co-facilitator has been on maternity leave, but she is back. So I'm hoping that we're going to be starting up again. And like I said, it's been a while since we've done a relationship series, so it's likely going to be one of the first series that we do. Okay, so I see a question. What are some advice that you have for those online dating and staying safe? That's a great question. So online dating, like I said, I think has really changed the face of dating, particularly for those with physical disabilities. And just like I believe dating in person, there still poses risks. And safety concerns with online dating. My initial recommendations would be to stick with online dating portals that have good reputations, even maybe some that have background checks as part of their registration process, or other recommendations that you get from peers. That would be my first suggestion. Also, making sure that you're just being really smart about what information that you provide in terms of somebody to someone that you haven't met yet, or before you meet up in physical, well, particularly now in COVID. I'm not sure that this is happening quite in the same capacity as it would be prior, but before any type of physical meetup, that you've done your homework and you feel comfortable doing so. There might be also other tips and tricks that I might be able to send out, that I can certainly send to the Jeff Foundation, that go into a little bit more detail about things that you can do to keep yourself safe, when engaging in dating outside of online. I want to make sure I don't miss these questions. Okay, I say, how can I, as a parent, open the door for my son to be more comfortable to talk about sex and his needs? Oh, I love this question. Okay, so first of all, thank you so much for joining as a parent. As I mentioned to the Jet Foundation, I always get nervous talking about sex and intimacy when I have parents and youths on the line. So thank you so much for joining us. I mean, whether or not you know it yet, just by you engaging in a workshop like this, you're already taking steps to open that door of communication. So thank you for that. Um, I would, and I see a question down below, and I think that I can probably address this as well. It says that my son hasn't brought up questions about sex or intimacy. What should I do to should I bring it up or wait for him? I think that the more that a topic, particularly a taboo topic like sex and intimacy, the more that it is discussed in a household, that is what increases the comfort level. So the more that it's discussed, I think that the more that children are going to have, or adolescents and teens are going to have questions specifically surrounding that. And it doesn't have to start off necessarily with sex and intimacy. I think that just having open discussions of, hey, tell me about your friends, or tell me about, if there's anyone that that you've had any romantic feelings toward. So it can start off kind of learning about the connections that they're having with others, and then building from there. Have any of those connections sparked any romantic interests? And then always be ready to connect them with someone who might be able to have that conversation if that is in fact not you. So for example, if you feel as though maybe talking to a therapist about sex and intimacy might be a little bit of a better fit, that's also something that you can do as well. If you have concerns about your child maybe not opening up, but you maybe want to make sure that they're getting that support in some capacity. But again, my biggest recommendation would be to start small, start talking about those connections, ask questions about their friends, ask questions about how they're developing friendships, how they're developing relationships. And that's going to actually give you a lot of information. It's going to give you information about whether or not they're feeling isolated, or whether or not we need to do more to help further engage them. And then that can, I believe, grow and blossom future conversations about relationships and sex. I hope that I answered your question. If I didn't, let me know and I will say more. Should I encourage my child to speak to their doctor about sex? Yes, that is my answer. I hope that other professionals would agree with me, but I particularly if they have expressed that they have questions or that they have interests, or if they're around a certain age where maybe they've gone through puberty, and you as a parent recognize that there may be questions about it, absolutely. What I would do is choose a provider that there is a level of comfort with. Have your child be a part of that discussion. Who would you feel comfortable asking these questions to, and then giving them privacy in having that discussion. You are so welcome. Okay, I have another one. I want to date, but I'm really nervous. Someone will not like me for my disease. How do I bring it up? Well, that, my friend, is a projection. So no, I'm actually glad that someone said this, because I hear this all the time, and it's a very common reaction to have towards the thought of dating, particularly when you're living with a neuromuscular disease or have another physical disability. So my advice goes back to basics of trying to pause when you start to have that projection. So when you start to have those thoughts of, what if someone doesn't like me for my disease? Or what if someone doesn't like the fact that I can't do everything that they can? Try to reverse that statement. What if someone does like me even though I have a neuromuscular disorder? What if someone doesn't mind the fact that there are some things that I can't do? The more that you, and that's likely just a simple CBT trick, but the more that we can reframe and reshift that conversation, that can try to pause and break those projections from actually stopping us happening. So it's of course natural for us to have hesitations and hesitancies, particularly when it's something as vulnerable as dating, right? We're giving trust and love to another individual. So of course we want to make sure that we may have concerns around that. But I encourage you that once those projections start to come up, just challenge them in your own mind. Because the reality is that you really don't know what other people may think or feel about you as a person until you give them that opportunity. So pause, try to recognize those projections when they happen, try to shift them around, and just being open to having that vulnerability that's going to allow you to express yourself. And then that way, someone's going to have the opportunity to get to know you. Probably easier said than done. I know that, vulnerability is a huge part of dating, and it's not easy. So I really give credit to so many of our youths and teens and young adults who are in the dating game, particularly in the neuromuscular community, because I know that it can be tough and it can be scary. But I promise you that by limiting some of those projections, you're going to open the door to a lot more connections. And hopefully that helped. Let me see. How can I encourage my son to date? So I think it probably starts with having conversations. So it probably starts with having conversations about their interest in dating or their interest in others, whether or not that they have an interest in dating, what their dating preference is, who they're attracted to. Having some of those, I think, like micro conversations up to actually addressing the task of, what are your thoughts about dating? How do you think you want to go about this? I think is key. So once you have some of those micro conversations, and I just made that up, once you have some of these like smaller conversations that kind of lead up to bigger topics like the all-encompassing dating world, then I think you might be able to better gauge where your child's at in terms of what their goals are. So you can talk to them again about those connections that they're building with others, but if they've expressed or you're inclined to know that they have an interest in dating, ask them, you can ask them questions about what their goals are around dating. Are they interested in having a partner? Are they interested in spending time with someone romantically? And then how can we make that happen, particularly if it's something that is a goal of theirs, whether that's an online platform or whether that's, becoming part of a specific social group just to meet more people. That encouragement of just societal presence, I think, is also key, because the level of comfort that you gain just in any social situation is going to help you in the dating world too. So I hope I'm answering these questions okay. But yeah, so those micro conversations about what their interests are, of course, knowing what their goals are around dating. And then again, if it's part of what they want to have happen, asking them how we can make it happen, by what context, whether that be something social in the community or whether it be something online. What are some good date spots and that some have tried that have worked and were accessible? Oh, this is a good one. So this isn't a date spot, but it's a trick that so many of my young adults with DMD and other neuromuscular diseases tell me. But the particularly going out, let's say you're going out to like a bar or a restaurant, the lift feature on your wheelchair to make you eye level with maybe another able-bodied person. So many individuals say that feature alone is really life-changing and makes that experience of being out with able-bodied people just that much more accessible, really. What I don't know of any, a lot of places are well, let me backtrack. A lot of places say that they're ADA accessible. My first suggestion would be, if you have a date spot that you have in mind, do some homework ahead of time. Make sure that they have the appropriate ramps and accessibility. Just because a place has a ramp doesn't mean that it's going to be fully ADA. So that might even mean like taking like a practice trip ahead of time and making sure that a place really does have like full accessibility. So for example, if you wanted to go to a place like Dave and Buster's or something, you know, maybe trying out a place, trying to go there ahead of time to really see like, okay, are there games that I can access, that I can maneuver? Do I have a place that I would feel comfortable sitting and being able to have a conversation? I mean, that's a lot of date prep, and I know that, you know, not everyone wants to have like a practice date, but it might be something if you're really looking for a place where you don't want any surprises and you don't want any hiccups, to try. I don't have enough, I can't believe I haven't said this yet, but I don't have enough good things to say about organizations like the Jet Foundation and the MDA and Cure SMA and PPMD. I mean, a lot of those organizations also too have really great programs for young adults where you can connect with others as well. I strongly suggest getting involved in some of the diagnosis specific support groups, not just for the social connections, but also for the resources too. I know that I was previously involved with the MDA that had like an event at like the Philly Stadium, and they specifically like choose venues that are fully ADA accessible. So not that you can have a date at the Phillies unless you just go to a Phillies game, but not even now in light of COVID. But just to say that those support organizations usually sometimes can do that homework for you. Okay, that was a great question. Okay. Do I have time for more questions, or should we stop?
No, you can totally keep going if that's okay with you.
Yes, totally. Okay. Should I encourage my son to speak more at his next appointment to be more of an advocate for himself? So I don't know how old your son is, but it actually doesn't matter. The answer is absolutely, positively, totally yes. I love this question. Yes. In fact, I think some of the first steps to, actually, I'm going to backtrack. The first step to this is even making sure that your child knows what it is they're going to the doctor for. So in the car ride to the doctor's appointment, saying like, hey, do you know why we're going to the neurologist, or do you know why we're going to the orthopedic doctor? To get a sense from him of what he knows about his body and his diagnosis. And particularly, of course, like making sure that it's age appropriate and developmentally appropriate for them to have the information that they have. Once you have that, absolutely encourage them to be a part of that conversation. Something simple that you can do is have encourage them to answer the questions the doctor asks. So when the doctor, which we all do in the medical field, and appropriately, as we're directing questions to mom and dad, even like telling the physician like, oh, actually you can ask him how he's been feeling, or how how he likes his new scooter, or whatever the case is. Really encourage them to do a lot of the answering. And then, further things that you could do would be encourage them to ask specific questions that are totally 100% developed by them. So I've had parents do this. Some of the questions can be super eye-opening because they actually have questions about their disease and their progression. And some are just super awesome about like, what color they can get their wheelchair in, or why does it take so long to get an appointment? But I think having questions that come directly from the patients themselves is really important. And I think a great way to practice advocacy. Okay, I think we have one more. Oh, we have a couple more. Okay. What are ways to have romantic times in a wheelchair? Okay, these ways absolutely, positively exist. I don't think we have enough time to go into it today. However, to whomever asked this question, there is a document called Pleasure Abled. I referenced it when we talked about the different specialists that can help you with gaining independence. It's authored by a few individuals, one of which being Kate Natali. She has an interesting spelling, so I'm going to type it into the chat, or at least I thought I was going to. Let me see. Oh, there it is. I'm going to type this in for you super quick. It's not letting me. I'm going to type it in. If someone receives it and is able to share it with everyone, just in case it doesn't go. But I'm just going to put her name. So she writes a book or a pamphlet called Pleasure Abled. And it specifically goes over exactly what you're talking about. It is a document that basically talks about people with physical disabilities, whether it be, muscle diseases or spinal cord injuries, and specific techniques, tools, methods to have intimacy if you are in a wheelchair. So those things absolutely exist. Another great, and if you are personally interested in getting that information or getting that pamphlet, send me an email because I can send it to you directly. Also, my colleague, Catherine Starantino, this is a lot of what she does her work with as a sex therapist, and she sees people virtually if you're interested. Though she also can kind of talk to you about these things if you're interested. But thank you for a great question. Okay, we have a few. I think we have one more. Okay, how can I talk to my parents about going to college and dating? I want to do more. Absolutely great question. So I would talk to your parents about if going to college and dating seems like something that is a goal of yours, but kind of far away from where your parents view you at, like if your parents are viewing you necessarily as somebody that may need, a lot of assistance in going to college, or maybe they're not ready to have that conversation yet. If there's a disconnect basically between where you feel like you're at and where your parents feel like you're at, that's what needs to get changed first. So that's what I would encourage you to say, like, hey, can we have a we need to have a little bit more conversations about what I'm capable of doing. So when it specifically comes to college, actually, I'm going to start someplace else. When it comes to talking to parents about your own independence, part of what I say is show them, too. So when you are able or capable of doing certain things yourself, and these aren't necessarily like physical tasks, but even things like organizing your healthcare, calling or canceling an appointment, arranging a meetup with friends, or orchestrating advising your healthcare provider to do something specific for you. When they're seeing you use those skills, that's going to show them too that you're exhibiting a lot of the independence that you know that you have. Okay. So I would start with maybe displaying some of that independence, but also too engaging in that conversation. Because just like you may have concerns and fears about college and dating, your parents, because they're your parents, may also have concerns and fears about college and dating. So having that open communication and just having that dialogue back and forth is going to allow the air to be cleared, because particularly when it comes to college is something that that with planning can be executed really well. We have a lot of supports in place that help our college-aged individuals with neuromuscular diseases. We have organizations like OER, we have the Office of Persons with Disabilities, which is on every college campus. So with the appropriate amount of planning, and by your parents seeing that you're capable of making those decisions and making those adjustments and doing that planning, by doing that, and having those by having those discussions, showing that you're capable of connecting with those organizations, having a plan for X, Y, and Z, that's going to help show your parents that you're more prepared. When it comes to dating, I think that it's always important to be transparent, particularly if having a partner and a romantic relationship is something that is important to you. I think it's important for you to, like we talked about in the presentation, kind of have that balance. Of course, keep your own private, allow yourself some privacy, but also a little bit of transparency where you're telling your family and your those that are closest to you what your goals are, because ultimately what we want is a supportive network. So the more communication we have, the more preparation we have for things like a dating life and college life, the more backing we're going to have from those who support us the best. So I hope I answered your question. But start small. Start by showing that you're able to do some things independently, and then just have those discussions. Even sitting down and having a more serious conversation about planning for college and planning for a romantic life in and of itself is a very mature thing to do. So that conversation in and of itself is going to show them that this is something that's really important to you. I think that's everything.
All right, well, if that's it for questions, I think we can go ahead and begin with closing here. Sarah, thank you so much for your presentation and answering questions. Your work's amazing, and the entire Duchenne and neuromuscular community appreciates it and all you do.
Oh, thank you. Thank you so much for having me. I was starting to lose my voice this morning, so thanks to everyone for bearing with me if I paused a lot and was like adjusting to talking into a microphone. Certainly COVID has brought about a bunch of changes that we're all getting used to, but I can't thank everyone enough for their participation today. The questions in the Q&A were awesome. Please, please, please feel free to email me if you want any additional resources. I'm happy to help.
Awesome. Thank you so much, Sarah, and you're great, so don't worry about it.
Thanks.
And thank you all for joining Jet Foundation's virtual workshop series today. This presentation has been recorded and will be uploaded to our website if you would like to watch it again or share with others in the community who could benefit from it. For any other questions, you may please feel free to reach out to us anytime. Thank you again, everyone, and join us next Wednesday for another virtual workshop series, and have a great week.
Thank you.